Come in. Hi, Mr. Desai.
Hi, Doc.
Hi.
Hi.
Dr. Aurora, come in. Grab a seat.
Cheers. Thanks for seeing me.
That's alright. How can I help?
I think I need an MRI to find out what's going on with my elbow. It's causing me a lot of pain, a lot of discomfort. So, yeah, if you can help me out with that, I'd be really appreciated.
Sounds like what's been going on.
Yeah, it's really annoying.
You don't come very often, so something must be going on. Tell me about the elbow. What's been happening?
It's just getting to the stage that every time I try and use it, after a couple of minutes, I have to stop, and it's just excruciating. I actually just stopped today. I was doing a job, left all my tools just come down here.
Oh.
I've got to shoot off back, so just think if I can get the MRI, get things sorted, I'll be grateful.
And the time pressure as well.
Yeah,
we'll try and be as quick as we can. For sure. You mentioned a couple of things, MRI.
Yeah.
I want to come back to that. We do MRI scans for elbows sometimes.
Okay.
There may be a few other things that we might be able to do in place or that's better. So we'll certainly come back to that. I'll come back to your elbow as well.
Yeah.
Clearly that's the focus of what's going on. But I want to touch upon work and tools and drop things. Tell me, what's work?
I'm a carpenter. Yeah.
I see. Okay. So a lot of drilling, a lot of sawing, that kind of stuff.
Yeah.
Right-handed?
Right-handed.
Okay.
I need this arm, I need the elbow. Can't do it.
Is it slowing you down?
It really is. I've got a couple of jobs on at the moment, and having to say a couple, I've got a lot of jobs on, more than normal, and I've got to get them done in the next couple of weeks.
Wow.
If I can just get through those, then that'd be much better. After that, I can calm things down. But I need help.
Gosh, so this is a busy period at the moment.
It really is.
Busier than
really
normal.
is. Yeah.
Any reason?
I've taken on a lot of jobs. Maybe more than I should have. Basically, I'm trying to pay for my daughter's wedding, which is coming up, and if I need to fulfil these jobs, get paid, and then if I don't do it, I'm
Gosh, a lot of pressure on you then, isn't it?
Yeah. It is. I guess. Yeah.
Wow, so clearly it's affecting you at work. No doubt. Congratulations, by the way, firstly about your daughter. I mean, daughter getting married is a big thing for any father. But I can see the pressure you're under. With work and at home. Who is at home?
It's my wife and my daughter.
Wife and daughter.
Yeah.
Okay. Is it affecting you there as well? Clearly, it's affecting your work.
Well, I'm helping out with the wedding as well, so that's. I'm not doing what I can do. I've been making some furniture and things, and most of that's all done, but heavy lifting, all this stuff, trying to prepare for the wedding. We've got help, there's some family coming over and all that stuff, but I'm just not really, I don't want to let them down. I don't want to let them down.
I can understand that. But it's full on, isn't it, at the moment?
Yeah, it is, it really is.
While we're talking about you and lifestyle, certain things people turn to when it comes to times of stress, pain, things like smoking and alcohol. I don't know if you do any of those at all.
No.
Have you tried anything for this at all?
I've tried some paracetamol. It helps a little bit, but not a lot. So.
Touches it, but it doesn't do too much.
No.
Okay, let's go back to the elbow then now. So how long has it been exactly?
It's been about 2 months, maybe.
Okay, so quite a while.
Yeah.
Did it come like this, or was it more of a gradual thing over the time?
Probably more gradual over a few weeks.
And recently it's got to a stage where it's worse than it was before.
Yeah.
Okay.
This morning it's just agony.
Is it just pain, or is there any other symptoms that you're getting with it?
I think it's just pain.
Just pain. And whereabouts? Is it all over the elbow, or is it in one part in particular?
That's weird. I think it's on this half, like this side.
It's on the outer side.
Yeah, like just down here. It's
okay.
It seems to be.
It's quite a common place to get pain, actually. I mean, a couple of yes/no questions. If that's okay. No, nothing unusual, like any swelling.
No.
No redness at all.
No.
Doesn't feel stiff in any way.
No.
Doesn't feel hot.
No.
Okay, shoulder, wrist, they're all okay.
No, that's all fine.
Good. Other joints all okay.
Yeah, everything else fine.
Any problem with joints in the past?
No.
Good. Family history-wise, no joint issues that you can think of.
No.
Okay. And generally, you feel well in yourself.
I feel.
Apart from this pain, obviously.
Yeah.
Gosh. I mean, when it comes to pain, lots of things go through people's mind. They have thoughts as to what's going on. Did you have any ideas yourself as to what was going on here?
That's the thing, because I haven't knocked it or anything like that. It's just come out of the blue. So I'm just like, why is it? To happen now as well. It's just.
There's no bumps, nothing like that, nothing you can think of. Gosh, we'll certainly try and get to the bottom of it. There's lots of causes of elbow pain, which we can have a look at later on. I mean, clearly you're worried about work, finance, that all makes sense. Anything else, particularly worrying about everything here? They're big enough, aren't they, those things? Yeah. We'll certainly look at those, and I think we need to come back to those two because we need to look at how we can help you from that situation as well. And you mentioned MRI scan, and I promise we're going to come on to that. But while you were here, was there anything else you thought we could do perhaps with the pain, or anything you had in your mind?
No, I mean, just whatever you can do to get me back. Find out what's going on, and then get me back on.
You just want the pain out of the way, I assume, isn't it? Get cracking again.
Yeah.
Okay. Now you've clearly been through a lot. When people do go through a lot, mood can be affected. Do you feel down, depressed? How's your mood?
Oh no, I'm not down or anything like that. No.
Okay. It sounds like mainly stress, isn't it?
Yeah, I think so.
Okay. Well, how about, thanks for all of that, that's a lot of information you give me. How about I have a look at it and then put a plan in place, see what we can do together as to how we can take this forward?
Fine. Okay.
Thanks, Mr. Desai. I know I put you through a lot of questions and examined you. I think I know what's going on here.
Okay.
I know you mentioned that you weren't quite sure when you came, but I think we're doing something called tennis elbow, to be honest.
Right.
I don't know
Okay.
if that's something that you ever come across yourself.
I've heard of it, but I don't know anything about
It's
it.
very common actually, it's something that we see quite often. It's very simple. I mean, the area that you're describing the pain over,
Yeah.
we get a lot of things that join to the bone in this position, and when you have a lot of overuse of that area, it can cause a bit of pain, a bit of
Right.
swelling.
Okay.
And kind of classic to what you're describing actually, so I wonder if that's what's going on.
Okay.
It's actually a really common problem that we can treat quite well.
So you can do something about it.
Yeah, certainly, but I think there are a few things going on here that we can perhaps have a little bit of a chat about.
Fine. Okay.
I was going to start with the MRI scan. I know that's what you came in for. We need to have a little bit of a chat about that, but I don't think it's the first thing I would do at this stage because I don't think it's going to add any value as such as to what we're going to do now. But we still can have a bit of a chat about that if that's what you wanted. Pain. We need to look at how to get rid of this pain. There's a number of different ways that we can deal with pain in tennis elbow, ranging from simple things like gels and medications through to injections and physio, but we'll certainly have a chat about what works for you and what suits you best. We need to get on top of the pain.
Fine. Okay.
And I suppose we need to have a look at the two situations I think are contributing to this. And number one, your work, and number two, the stuff that you're doing at home with the wedding. I think having a chat about those might be really important in looking at how we're going to get this better in a long-term situation. Now, there's a lot of stuff there. What do you think? What sticks out most? Where should we go first, do you think?
Well, I mean, I'm happy to leave the MRI. It doesn't sound like it's going to add anything. So I just want the pain. I just need to carry on working. So if you could sort out the pain, that'd be great.
There's a number of ways we can look at it, like I said. I mean, normally with this condition, we tend to start with gels, pain relief gels.
I've done gels. They're too messy.
Okay, yeah, no, absolutely. I mean, it's not for everyone, I suppose. Medication is an option. You mentioned paracetamol already.
Yeah.
Paracetamol's great, I think, for hitting pain quite well.
Okay.
But I'm thinking more along just something called a non-steroidal anti-inflammatory, something called like ibuprofen, for example. That can hit both pain
Right.
and also the kind of swelling and inflammation as well. So
Okay.
maybe that might be an option. I don't know if you tried ibuprofen before.
I've had it before. Yeah.
Didn't cause any problems.
No.
A couple of things that we think about: asthma, something that we can't really
No,
use. And you don't have asthma, I know
no.
them, you know. And indigestion is the other one. I don't know if you had that before.
No.
Fantastic ulcers and things. So that's really good. So we could think about maybe buying some over the counter might be useful for that.
Okay. Yeah.
And obviously, if things don't work, we can look at the more sort of strong things going forward.
Right.
But I think we should look at the two triggers really, and I wonder with the work side of things, I know it's pressurised and difficult, but one of the key things we think about with tennis elbow is rest of the elbow.
Yeah.
Do you think there's any way we can maybe look at taking some time off work?
No, I can't take any time off work.
Okay.
Not for a few weeks until I get these jobs done. After that, I can take some rest, but not for the next couple of weeks.
Yeah, look, I understand. You mentioned contracts and things, and it's quite busy at the moment. I understand that. I wouldn't want to push you into anything. Rest is important for this condition. And maybe we could look at the second part of the day. Maybe when you're at home, you mentioned you're a little lifting at the moment, you're building things for the wedding.
Okay.
Could you maybe take a bit of time out there and give us some space, do you think?
Yeah, I can. Yeah.
Okay.
Yeah. The family said I'm working too much, so they said they'll. Yeah, I can.
Okay, fantastic. I mean, it's not ideal with work carrying on, but at least it's a kind of go-between. And maybe for the first couple of weeks, like you said, when it's busy, okay, you carry on your work. Maybe as a more long-term thing, we could look at some time off, maybe when things have settled down.
Okay.
But for now, give yourself that break. And maybe a bit of ice in the evening, sometimes that can help.
Okay.
Maybe that might work.
Fine. Okay.
So maybe no MRI, we'll leave the MRI for now.
Yeah, fine.
Maybe we'll go with the ibuprofen from the chemist, which you can pick up.
Okay.
And maybe we'll give yourself a bit of space in the evening and not do any home lifting then.
Okay.
I'll aim to maybe give you a call in about 10, 12 days, see how things are.
Fine. Okay.
If we're not winning, we can look at some of those other steps at that point. And obviously, if you have any queries in the meantime, if it gets worse or anything that's new develops, just give me a shout, you know where I am. Please feel free to give me a call. But does that sound like a plan that works for you?
Yeah, no, that sounds good, Doc. Yeah, if we can, I'll try these things, but I'll speak to you in a bit.
Perfect. Great. Well, any further queries, let me know. We'll catch up in a week's time.
Thanks, Doc.
Cheers, Mrs. Bye.